Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with special concerns of women, starting with the letter B, part 2. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and then specific to men, then issues of the hormones and the metabolism. Then I'll address the issues of homeopathic remedies on infections, infestation, and the immune system. Then issues surrounding fertility, pregnancy, childbirth, and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature mirror people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, of stooped appearance, with an anxious expression and a craving for sweets, and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. Now, I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So let us continue with learning how homeopathic treatments can help with special concerns of women, continuing with the letter B, part 2. Between puberty and menopause, a span of approximately 35 years, a woman ovulates about 400 times, normally at intervals of 28 days. If an egg is fertilized, pregnancy follows. If not, menstruation occurs as the vascular lining of the womb is shed. This cycle of fertility is maintained by 3 hormone-producing glands, the hypothalamus, pituitary, and ovaries. The ovaries produce 2 hormones, estrogen and progesterone, in response to 2 hormones produced by the pituitary, which are follicle-stimulating hormone, or FSH for short, and luteinizing hormone, LH for short. Estrogen levels respond to FSH levels, rise dramatically in the 12 days leading up to ovulation, and are at their lowest during menstruation. Levels of progesterone secreted in response to LH are highest after ovulation, preparing the lining of the uterus, the endometrium, for implantation of the egg. Menstrual bleeding begins approximately 2 days after estrogen and progesterone secretions reach their lowest level. About 1.5 ounces of blood are then lost over 3 to 7 days. The uterus or womb is a thick-walled, pear-shaped organ about 3 inches long, with a narrow neck or cervix at its lower end. The mouth of the cervix juts into the top of the vagina. Opening into the bulbous upper ends of the uterus are 2 tubes about 4 inches long, called the fallopian tubes. The fallopian tubes are lined with tiny waving hairs that transport eggs from the ovaries to the uterus. It is in one of these fallopian tubes that fertilization usually occurs. There is no direct connection between the ovaries and the fallopian tubes. Eggs are simply released into the fluid-filled perioneal cavity and wafted towards the fringed entrances to the fallopian tubes. The ovaries themselves are almond-shaped and about 1.5 inches long. At birth, they contain many millions of immature eggs and follicles, but as already mentioned, only about 400 of them reach maturity. Although several eggs may begin to mature each month under the influence of FSH, however, usually only one egg totally matures. Once it's been released from its follicle, the follicle turns into a corpus luteum, literally yellow body, and proceeds to secrete large amounts of progesterone. The external female genitals, referred to as the vulva, consist of the fleshy inner and outer labia, or lips, that conceal the entrance to the vagina, and the clitoris, which lies just above the urethral opening where the inner labia meet. The clitoris is very sensitive and focus of many of the sensations that trigger orgasm. The vagina is about 4 inches long, and it expands and lubricates during sexual arousal and is most sensitive near its entrance. It is protected from infection by populations of acid-producing bacteria. Breast development is one of the first signs of puberty in women. The breasts move with the pectoral muscles underneath, and their hang is greatly influenced by posture and the tone of the muscles that brace the shoulders back. Embedded in the fatty tissue of each breast are 15 to 20 clusters of milk-producing glands, whose ducts converge on the nipple. The pigmented area around the nipple, called the areola, contains glands that keep the nipples supple. Breast troubles continued. Galactorrhea is the abnormal production of small quantities of breast milk, usually from both breasts, unrelated to childbirth or breastfeeding. The discharge is whitish or greenish. The causes include excessive production of milk-stimulating hormone prolactin by the pituitary malfunction or the hypothalamus, cancer of the breast, drugs such as oral contraceptives, tranquilizers, and diuretics, and more rarely injury, burns, or surgery. Nervous disorders such as shingles and problems with cervical part of the spine, which affects very few women. Notably, women who suffer from amenorrhea and can also occur in men. Milk production ceases once the underlying cause is found and treated. Specific remedies to be taken 4 times daily for up to 7 days. Discharge of milk follows injury to the breast. Use Arnica 30C. If the breast remains swollen after taking Arnica, use Bellis 6C. Where the breast is hard and painful to touch, use Conium 6C. Lumps in breast may be due to a cyst, which is a fluid-filled sac of tissue, to fibrinosis, which is a thickening of the milk-producing tissue, to a benign growth, or to cancer. Pain is rare in such cases, so regular self-examination of breasts is important. Only a breast infection or abscess can be relied on to cause pain, and they are also of sudden onset. If you notice any changes in the nipple shape, skin color, skin texture, or any hard or tender areas you have not felt before, see your doctor as soon as possible. Breasts may feel slightly tender before a period, but this is perfectly normal and due to changing hormonal levels. Cysts are conventionally treated by draining off the fluid, provided diagnosis has been determined. Otherwise, they need surgical removal. Benign tumors are also treated by surgical removal after such treatments. Checkups are carried out on a regular basis. In homeopathic medicine, all these conditions are treated constitutionally, although the remedies listed below may be used while constitutional treatment is being sought. Specific remedies to be taken 4 times daily for up to 14 days. Cyst diagnosed. Affected area hard and painful. Stitching pains in the nipple and itching inside the breast. Discomfort worse just before and during period. Wanting to press breast hard with the hand. Use Conium 6C. Cysts present. Breasts have purplish tinge and feel extra tender before and during period. Chill, damp weather, and emotional strain make discomfort worse. Use Phytolacca 6C. Pain comes and goes suddenly, reducing you to tears. Use Pulsatilla 6C. Breasts swollen, hard, and thickened, nipples sore, cracked, and blistered. Use Graphites 6C. Breasts painful and engorged with milk at time of period. Use Mercurius 6C. Breasts red, throbbing, and heavy. Lying down makes the discomfort worse. Use Belladonna 30C. Breasts feel hard. The slightest movement makes the pain worse. Use Bryonia 30C. Self-help. Reduce your intake of animal fats as well as tea, coffee, and other beverages containing caffeine. Occasionally substitute oily fish, such as sardines, herring, salmon, or mackerel for meat or dairy products. An 8-week course of vitamin E is also recommended, gradually increasing your daily dosage from 100 to 600 units. However, if you have high blood pressure, check with your doctor first, as extra vitamin E can temporarily raise blood pressure. Extra vitamin B6, magnesium, and zinc, and also evening primrose oil and kelp would also be beneficial. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.